Before we begin this video, I would especially like to thank the Breath of Life Foundation for their support of the National Center for Vermiculite and Asbestos-Related Cancers here at the Karmanos Cancer Institute. Through the foundation, the 16 locals of the Central States Conference and their Vice President Greg Rivard, along with the Central States Insulation Contractors Association, specifically Bud Turner, John Martin, and Tom Burcham, have been generous in funding the maintenance of our asbestos patient database and the mesothelioma biomarker research which we are involved. I'd also like to thank General President Grogan, Secretary-Treasurer Bud McCourt, and International Vice President Terry Lynch of the International Association of Heat and Frost Insulators for coordinating efforts with other asbestos researchers that coincide with the objectives of the Breath of Life Foundation.
Hello, my name is Michael Harbut. I'm a physician and specialist in diseases of the environment and the workplace. I'm in charge of the environmental cancer program at Detroit's Karmanos Cancer Institute, and I'm also chief of the Center for Occupational and Environmental Medicine, which is part of the National Center for Vermiculite and Asbestos-Related Cancers. All that having been said, this brief video presentation is designed to introduce you to the sorts of things that we do at Karmanos Cancer Institute when we are evaluating a person for asbestos-related disease. The purpose of this information and the purpose of this program is to help people who have been exposed to asbestos who may be at greater risk for some serious diseases, either now or down the road. Asbestos has been used everywhere in the industrial environment for the last 100 to 200 years. It's found in basements, it's found in ceilings, it's found in attics, it's found in walls, it's found around pipes. For me to tell members of the Insulator Workers Union where you find asbestos is sort of incongruous, but I just want to give you an idea that we understand where you've been exposed to asbestos in the past. Now, the major thing about asbestos, which is, as you know, a very tiny needle-like fiber, is that you breathe it in and it can go through the tissue of your lung and penetrate virtually every part of the human body. This results mostly in scarring of the lungs caused by asbestos. It's called asbestosis. It can cause a thickening on the covering of the lungs, which are called pleural plaques, and in some cases those pleural plaques can develop pain that can't be treated with hardly any regular medicines and requires significant narcotic intervention. There's an increased risk of lung cancer with asbestos. For example, if you have asbestos exposure alone, your risk of getting lung cancer is about 5 to 10 times that of the rest of the population. If you have a history of smoking or exposure to agents like cigarette smoke, along with that asbestos exposure, it jumps up to about 50 to 90 times the risk of that of the rest of the population. Years ago, we felt that once you discovered a lung tumor, there wasn't a lot you could do to extend a person's survival beyond about 5 years. We know better than that today. We know fairly conclusively that an early cancer detected is a cancer which has a greater chance of being defeated. And in fact, has been shown that people who have their lung cancers discovered early do live longer and do better. So one of the major things that we do here at Karmanos is, even though we can't stop the cancers, we look for them early. Now, among the other kind of cancers that have been associated with asbestos exposure are cancer of the covering or lining of the stomach and the lungs and the heart. This is called mesothelioma. This is the especially worrisome cancer that is worrisome in that it's so aggressive and so uncomfortable from an early stage on. There's also an increased risk of colon cancer. People say, colon cancer? How in the world can you get colon cancer with asbestos exposure? Well, nobody knows for absolutely sure, but it appears that when you breathe in the asbestos fiber, your lungs will take the fibers and move them to the back of your throat, and you swallow them, and the asbestos fibers set in the colon for years and cause colon cancer. Now, there's also pretty good data that many other types of cancer may be associated with an increased risk of asbestos-related disease. In other words, the more asbestos, the more likely you're going to get any number of cancers. So we generally try and watch people pretty closely for any sort of cancer. During the course of your evaluation, we'll also determine if in fact you do have an asbestos-related disease. Many times people who've been through a legal screening in other words, a screening of asbestos-related diseases developed for the purposes of litigation, really need to know if they have an asbestos-related disease or not. Sometimes the legal process is fairly unrelated to the actual medical process. Many times we'll find in the evaluation that people do not have asbestosis, but have asthma, or have emphysema, or have some other form of lung condition, which is much easier to treat than those caused by asbestos. One of the things that we do here at Karmanos is an evaluation for people with asbestos-related disease. But we don't start out saying you have asbestosis, or because you were exposed to asbestos, you definitely have the disease. In fact, we don't even ask you to make an appointment on that basis most of the time. What we do like to know is if you're feeling short of breath when you climb a flight of stairs, if you have wheezing, if you have coughing, if you have any chest pain, if you have anything that might be related to your ability to breathe. The most common presenting complaint of people with asbestos-related diseases is that they become short of breath going from the basement of their homes to their first floor. This alone would trigger a cascade of events which would require us to take a pretty good look at you and what sorts of problems you have and which may be related to asbestos exposure. We know, for example, that asbestos fibers don't really begin scarring or doing harm to the lungs for at least 15 to 40 years after the first exposure. In most cases, not in all cases, but in most cases.